headache, backache, or maybe that muscle strain after the gym. Painkillers can feel like magic, but there's more to these tiny tablets than you might think. Today, we're breaking down how they work, the different types, and what you need to know before you pop the next pill. We'll also be discussing the different types of painkillers, how they work, any risks involved, and when it's important to seek medical advice. So let's dive in. Painkillers, or analgesics, are medicines that help reduce or block pain. They don't fix the cause, but they can make life a lot more comfortable while your body heals. From over-the-counter options like ibuprofen and paracetamol, to prescription-only drugs like opioids, each type works differently and comes with its own set of benefits and risks. There are three main categories. First, non-opioid analgesics. This group includes paracetamol, acetaminophen, and NSAIDs like ibuprofen. These are often the first line of defense against pain. They're great for headaches, muscle pain, or period cramps. Then we have opioid analgesics. These are stronger drugs like codeine, morphine, and oxycodone. Opioids are for more severe pain, but they carry a higher risk of addiction and dependence. That's why they're usually only used when other options haven't worked or for very serious conditions. The third category is adjuvant painkillers. These are medications originally made for other uses, like certain antidepressants or anti-seizure drugs. But they also help with nerve pain. So, how do painkillers work? They work by either blocking pain signals from reaching the brain, or they reduce the brain's sensitivity to those signals. NSAIDs work by reducing inflammation at the site of pain. They block the production of certain chemicals that cause pain and inflammation. Opioids, on the other hand, bind to special receptors in the brain and spinal cord. This binding helps to dampen the pain perception and may also trigger the release of other chemicals that further reduce pain. While painkillers are helpful, misuse can be dangerous. Overusing NSAIDs can lead to stomach ulcers and kidney problems. Taking too much paracetamol can damage the liver. And opioids, well, they can be life-changing, not in a good way, if dependence develops. Here are some safety tips. Always follow the recommended dose and frequency of use. Don't mix different painkillers unless advised by a doctor. Avoid taking painkillers with alcohol, as this can increase their effects and cause further liver damage. If the pain doesn't go away or gets worse after a few days, get medical advice. Don't just keep taking painkillers. When should you seek help? If the pain is severe, sudden, or comes with other worrying symptoms like fever, weakness, or shortness of breath, it's time to see a healthcare professional. Also, if painkillers aren't providing relief, or if the pain is affecting your daily life, don't hesitate to seek medical advice. There might be other options available to help manage your pain. Remember, painkillers are meant to be a helping hand, not a crutch. Stay smart, stay safe, and take care of yourself. If you found this video useful, hit like, subscribe, and share it with someone who might need this info. Until next time, good health to you!